Hello, today is October 12, 2021. I took care of my patient last week, Thursday. My patient is a 65-year-old Caucasian female. She has been seeing my nurse practitioner now for 4 years for management of major depressive disorder, recurrent episode, moderate. Okay, a little background on my patient. She's full of She's the oldest of four children. She says she grew up in a healthy environment. She had a good childhood. She and her family are all close. She's married and she had three children of her own. Most of them live around her. She reported that her parent lived two doors next to her. All right. Okay, my patients for the mental status exam. Her appearance appropriate. She's well groomed for and dressed for the weather. She reported her mood as upbeat. She denied any anxiety. She denied any excessive energy like media. She denied depression, hallucination, or delusions. She said her temper has been under control. Her speech is intact. She alert and oriented ×3, and she followed the content of the interview without any difficulty. Her speech is clear and logical. She denied any suicidal thoughts or any intention to harm herself. She reported good sleep. She said she had been sleeping anywhere from 6 to 8 hours each night. She said she had been eating well. We tried to push vegetables and fruits. She said she had been eating plenty of those. For exercise, since she came from the hospital, she had not been walking that much. So she said she walked just from her kitchen to her room 2 times a day to maintain her physical health. Okay, for the DSM-5 ISIS-1 patient, patient has major depressive disorder. Recurrent episode is moderate. ISIS-2, I would defer that. ISIS-3, patient had chronic pain, COPD, seizure disorder, and she is morbid obese. She has morbid obesity with the BMI of 46.3. Okay, ISIS-4, the psychosocial environmental factors. Patient is doing great. She has a great marriage. She close to all her children and all her siblings, and she's very involved in her church. She says since she has been sick, her church family have been very supportive. So she's doing good. For the ISIS-5, I would give her 90. She's doing very well. And for my differential diagnosis for this patient, I chose generalized anxiety due to her secondary to her medical condition. She had bowel perforation back in May, and she had been in and out of hospital for that. Okay, patient, she had been on her medication. She had been on Risperdal 2 milligram nightly, Effexor 150 milligram BID, and vitamin D 4,000 units. What would be the plan for this patient? The plan, she will continue the Risperdal 2 milligram nightly, the Effexor 150 milligram BID, and the vitamin D. While in the hospital, she reported that the medical doctor started on her mirtazapine 50 milligram nightly, but she said she does not like it. She doesn't feel good on it. And she asked my nurse practitioner to discontinue it, but we asked her to go to the primary doctor who ordered it. For my references, the American Psychiatric Association 2013 Diagnostic and Statistical of Mental Health Disorder. And the other one is the Schultz Prescriber Guide 2021. Thank you very much. Have a great week. Thank you.